We need to know that babies can hear because permanent hearing loss can significantly affect a baby's development. Finding out early can give them a better chance of developing communication skills and help them make the most of relationships with their families and carers from an early age. About 1 or 2 babies in every 1,000 are born with a permanent hearing loss in one or both ears. Most of these babies are born into families with no history of hearing loss. The sooner we know if a baby has a hearing loss, the sooner we can provide the help and information needed. At one of your antenatal appointments, the midwife will discuss which screens will be offered to you during your pregnancy and after your baby is born. Newborn hearing screening is usually offered during your stay in hospital before you and your baby are discharged and is carried out at your bedside. If this is not possible, you may be invited to attend a clinic. In some areas, the screen is carried out in the home by specially trained health visitors or maternity support workers when the baby is a week or so old. Babies' hearing can be screened from when they are just a few hours old. The screen takes just a few minutes, it's very reliable, and it's not upsetting to you or your baby. If you would like your baby's hearing to be screened, details of your baby, the screen, and any hearing tests following the screen will be kept on the NHS screening information system. This information is data protected and only shared with staff who need to be aware of it, and sometimes used for audit and research purposes. This baby is being screened using the automated otoacoustic emission screen, known as AOAE. A tiny soft earpiece is placed in the baby's ear, and a sound like this is played. A hearing ear will respond to this by making a very quiet sound that can then be picked up by the equipment.
That is fine, Mum. Clever boy. Just going to turn him to do the other ear.
The whole procedure only takes a couple of minutes, and you'll be given the results as soon as it's completed. It's not always possible to get clear responses from this first test. This does not necessarily mean the baby has a hearing loss. It could be because of noise in the room, the baby being active, or because there is still some birth fluid in the ear which will be absorbed naturally over time. For this reason, the baby might require a second AOAE. This baby has remained peaceful throughout, and we've been able to record clear responses from both ears. So the screener can give to the parent a clear response letter and make a note of the outcome in the baby's records. If your baby had clear responses from both ears, it's unlikely they have a hearing loss. However, a very small number of babies may develop or acquire a hearing loss later in life, so it's important to keep a check on your baby's hearing. To help you with this, the screener will refer you to the checklists in your baby's personal child health record book.
There's one checklist for making sounds and another for baby's reaction to sounds.
Remember, if you have any concerns about your child's hearing at any age, please ask your health visitor or GP.
Here's your letter, clear response letter, and here's your red book back. Congratulations again, Mum, and all the best.
This baby had the AOAE earlier this morning, but we couldn't get a clear response. So the screener is going to carry out a different screen. This is called the Automated Auditory Brainstem Response, or AABR. For this screen, it's important that the baby is very settled, preferably asleep. This time, the baby's response to sound is picked up through sensors which are placed on the baby's forehead, nape of neck, and shoulder. Soft sounds are then played through headphones specially made for a baby. This screen can take about 15 minutes to complete, during which time the baby's responses are automatically measured. If the baby has clear responses from both ears, the screener will record this and refer you to the checklists in your personal child health record book. If, after the AABR is completed, the test results do not show a clear response from one or both ears, an appointment will be made for you to meet a hearing specialist in an audiology department. Being sent for this assessment doesn't necessarily mean your baby has a hearing loss, but it's very important to attend this appointment so that your baby's hearing levels can be established. Babies who have spent 48 hours or more in a special care baby unit or a neonatal intensive care unit will be screened using both techniques, as these babies have a higher risk of hearing loss. As we've seen, identifying a hearing loss as soon as possible is important. Screening is quick and harmless. Your baby's hearing can be screened within a few hours of birth, and information and help is available at every stage. If you have any concerns or questions about your baby's hearing at any age, please contact your midwife, health visitor, or GP.